All right, everybody. So we have kind of some sober news. Uh, as you all know, the coronavirus has been spreading throughout the world and getting worse. There are at least 66 countries affected, and there have been almost 3,000 deaths now worldwide from the coronavirus. Um, and there's been like 86,000 cases, over 86,000 cases of this disease. Um, and unfortunately, in the United States, we have our first death from the coronavirus. Um, this is from NPR. It says a person in Washington state infected with coronavirus has died, according to the Seattle and King County Department of Health. The fatality marks the first death associated with the virus in the United States. The health department had no further details at the time of the announcement, but plans to announce more Saturday afternoon. The death comes after U.S. health officials have warned that coronavirus now appears to be spreading within the country from person to person, independent of any foreign travel. The Centers for Disease Control and Prevention acknowledged three such cases, known as community spread, in the U.S. late Friday night. Um, when you have community spread, someone appears to have been infected by someone, but you don't know who that person was. So this is legitimately a pretty scary thing. Now, honestly, we obviously should not panic. We got to keep our wits about us, stay smart, but we got to be intelligent about this right now. And so I'm urging a few different things to all of my many, many viewers. Number one, if you're sick, stay home. We don't want it. We're not interested in it. We actually don't want it, believe it or not. We don't want it. So go ahead and stay home. Um, Number two, disinfect, disinfect, disinfect. Wash your hands, wash surfaces before and after you eat on them. Just be very aware. These are the things that we should be doing anyway to keep ourselves healthy. But this now becomes even more important that we are aware of those things. Um, Now, I want to say something here too, because this is a part, in my opinion, of the argument for universal health care. Just as we have a fire department, because we realize that when one person's house is on fire, it poses a potential threat to the surrounding houses. And it's just sort of a common sense thing aside from being about caring about other human beings, aside from being an empathy issue, aside from being a moral issue about how we choose to treat the least of these in this country, who may not be in a position to foot a private firefighter bill, we realize that we need to have it because it really does benefit everyone else through stopping the spread of the fire before it gets out of control. So we should have the same approach to healthcare in this country. I mean, sure, there are some diseases like cancer which are non-communicable, but there are so many communicable diseases, so many diseases that can simply be spread through a handshake, through normal touch, through breathing the air that somebody else is breathing. We really need to be not only compassionate and care about the elderly, care about the young people, but we should also care about ourselves. We should care about preventing the spread of diseases. And God only knows how many people are going to refuse treatment or refuse to get tested because of fear regarding medical bills. Well, I'm just going to pray that the Lord going to handle it, and then not do what is necessary in order to protect not only themselves, but everyone else. I have a niece who is 5 months old almost, just born into this world. And I want her to be safe. And diseases like this have more of an impact on the elderly and the young. I would feel much more comfortable if I lived in a place where I knew anybody who sneezes can go to the doctor and get checked out to make sure there's not something seriously wrong with them without having to worry about going into medical debt. Here's another article that I found. Oh my goodness, where did I find this article? I'm sorry, I don't remember. I'm sorry, we're having a hard time today. But this says at least one American has already incurred hefty bills for seeking treatment for what they thought was the coronavirus. They had a flu test, came back positive, got some treatment. 2 weeks later, he receives an insurance claim for $3,270. His portion is $1,400. We have so many people in this country who can't even afford a $500 medical emergency or a emergency of any kind. And we're going to tell those people, make sure you get treatment. Make sure you do what you're supposed to do. Make sure you go to the doctor. Why? So I can come away with a $1,000 medical bill? That doesn't make any sense. That person seeking treatment is helpful to you and to me because they help to prevent the spread of it. And we can get them quarantined or get them wherever we need to get them so that we can heal them while the rest of us stay away from that person and stay healthy. And here's the other thing about our system. We've got this terrible combination of low wages, low stagnant wages that are barely moving, and in addition to that, no universal health care. So people feel this pressure to work. Benefits suck at a lot of these jobs. People need to continue to work. So they come in sick, they coughing and sneezing and snotting all over me. There have been several children I've seen this week at different daycares I've been at different schools that I've been at, that have been sick. And I'm like, why the heck are you here? We have a global outbreak of a serious virus, and you've brought your child to school to start sneezing and coughing all over everybody else. But this is the system we live in this country. These parents need to work. Paid time off is not a reality for everyone. Sick time off is not a reality for everyone. This is why we need a universal healthcare system. We need paid time off. We need paid sick leave, paid maternity leave, mandated by law, because these things benefit everyone. Here we are in a situation where we have this stupid for-profit system that is actually putting our lives in danger. And you think the treatment for it's going to be free? I'm sorry. I promise I don't have anything, but I'll cover my cough just in case so you don't get sick. When Nancy Pelosi goes on, the treatment will be affordable. Affordable for who, Nancy? For you? Or affordable for us? Or affordable for somebody who lives paycheck to paycheck that ain't got 2 dimes to pay for it? Not affordable for that person. Should be free. Should be free. We're talking about something that is going to prevent the spread of this disease and prevent it from getting worse. It should be free for every man, woman, boy, and girl to take whatever it is. If we give some antidote, some cure for it or something like that, it ought to be free. We're trying to stop a disease that could affect every single one of us. We're not just talking about cancer right now. Even then, I think it should be free because we need to, at the point of service, we're paying into it with taxes. Obviously, nothing's free. But free at the point of service because that compassion, that morality I believe in. But with this, it goes beyond that because this is about protecting our own behinds. Even if I'm not the one who has it, I want you to get tested if you have it. I want you to get treatment if you have it before you spread it to me. So this should be a no-brainer. If you haven't seen up until now the reason why we need universal health care, hopefully outbreaks like the coronavirus and others will help you to see sense, quite frankly. And if you don't see why we need paid time off, why people need to not have to worry about their pocketbook for taking a few days off, this right here should show you why. Because we don't want your behind coming into work, sneezing and coughing all over everybody with a 101-degree temperature. Why are you here? Because I'm not going to get to pay my bill because I'm going to be living on the street if I don't come to work. That's why I'm here. And you can't blame these people. We can't look at them and shame them and wag our finger at people who go to work sick. No, we need to wag our finger at this ridiculous, backwards system that puts us in a situation where people feel like they have to work even if they're sick. Instead of knowing that we have a robust social safety net in the richest country the world has ever known that will take care of them. We should be taken to the streets, ladies and gentlemen. Taken to the streets. Because this is absolutely ridiculous. I mean, we've got like over 2,000 deaths now. Almost 3,000 deaths worldwide. You know, we got to really be smart about healthcare in this country. We got to do better. We've got to do better. And maybe it starts now. Maybe it starts with this.